Avocado is often called one of the healthiest fruits, full of creamy goodness, healthy fats, and vital nutrients. But what many seniors don't realize is that even this so-called superfood can quietly turn harmful if eaten the wrong way. Doctors often remind us that age brings changes in digestion, metabolism, and medication needs, and something as innocent as avocado can create real trouble when those changes are ignored. For someone over 50, the difference between avocado helping the heart and harming it can come down to a few simple mistakes. That is why today's morning is so important. If staying safe, strong, and informed matters to you, then take a moment to subscribe and join this community of seniors who care about health and longevity. Your likes and comments not only support this channel, but also help others discover life-saving tips that every senior deserves to know. Eating too much avocado at once is a mistake that can quietly undermine its many benefits, particularly for seniors. While avocado is often praised as one of the healthiest fruits, loaded with monounsaturated fats, potassium, and fiber, the body processes these nutrients differently with age. A slowed metabolism, common after the age of 50, means that calories and fats remain in the system longer. A medium avocado contains more than 300 calories and about 30 grams of fat. Even though the fat is considered heart-healthy, consuming it in large amounts can push total daily intake far above what an older body comfortably needs. This excess increases the risk of gradual weight gain, which in turn places more pressure on the heart, joints, and blood vessels. Doctors often caution that weight gain in later years is not always visible in the same way it is during youth. Even a few pounds added slowly over months can increase the risk of high blood pressure, higher cholesterol, and type 2 diabetes. Because avocado is so creamy and enjoyable, it becomes easy to eat a whole fruit at once, or even two, especially when used in spreads or smoothies. But the body may not cope well with that amount of concentrated fat and calories at one time. Seniors who do this regularly may find their energy levels dipping and their waistlines expanding without fully realizing the link to their avocado intake. Another issue that arises from overeating avocado is digestive discomfort. Avocado is high in fiber, with around 10 grams in a single fruit. Fiber is vital for digestive health, but the digestive systems of older adults can be more sensitive to sudden or excessive intake. A large portion of avocado can cause gas, bloating, or constipation, especially in those unaccustomed to higher fiber meals. Studies on seniors' digestion confirm that the gastrointestinal tract becomes less efficient with age, and large amounts of any single high-fiber food can trigger discomfort that lasts for hours or days. Moderation ensures the digestive benefits of avocado are felt without tipping over into irritation or pain. Potassium content is another factor to consider. Avocados are one of the richest fruit sources of potassium, containing about 700 milligrams per medium fruit. Potassium is essential for balancing fluids, regulating blood pressure, and maintaining heart rhythm. However, when eaten in very large amounts, especially daily, potassium can build up to levels that pose problems for seniors with reduced kidney function. Doctors warn that elevated potassium levels, a condition called hyperkalemia, can interfere with heart rhythm and may become life-threatening if unchecked. Seniors who eat multiple avocados a day without monitoring their potassium intake from other foods increase their risk unnecessarily. Overeating avocado also creates a problem of nutritional displacement. When one food dominates the plate, others are left out. Seniors who choose avocado as the main part of a meal may unintentionally skip foods rich in protein, calcium, or vitamin B12, all of which are critical for maintaining muscle, bone, and nerve health in older age. This imbalance can slowly weaken the body, even while eating what seems like a healthy fruit. Nutrition experts often emphasize variety for precisely this reason. No single food, not even avocado, can provide everything the body needs. The safest way to enjoy avocado is to keep portions modest. Many nutritionists recommend no more than half of a medium avocado a day for most seniors. This provides healthy fats, fiber, and potassium without overwhelming the body with excess calories, digestive strain, or nutrient imbalance. Avocado works best as part of a balanced plate, paired with protein and other vegetables, rather than as the centerpiece of a meal.
Eating avocado in moderation allows it to support the heart, aid digestion, and deliver valuable nutrients without creating hidden risks. Too much at once, however, can quietly transform its benefits into harm. By respecting portion size, seniors can continue to enjoy the creamy richness of avocado safely, protecting both their health and their long-term well-being. Ignoring avocado's effect on blood thinners is a mistake that can put seniors at serious risk. Many older adults take medications like Warfarin, which are prescribed to prevent dangerous blood clots. These medicines work by interfering with the body's use of vitamin K, a nutrient that plays a central role in blood clotting. Avocados, while not as rich in vitamin K as green leafy vegetables, still contain a significant amount. Eating them in large or unpredictable quantities can alter vitamin K levels in the body, reducing the effectiveness of blood thinners and allowing clots to form when they are most dangerous. Doctors warn that the problem is not usually with eating a small, steady amount of avocado, but with inconsistency. Warfarin and similar drugs are carefully dosed based on how much vitamin K a person typically consumes. When seniors suddenly eat more avocado than usual, it can throw off this balance. The medication may no longer work as intended, and blood clots can begin to form in the veins or arteries. These clots are especially dangerous because they can travel to the lungs, heart, or brain, leading to pulmonary embolism, heart attack, or stroke. Even a small change in diet can have consequences when combined with these sensitive medications.
Another issue is that avocado is frequently eaten in hidden forms. It is not only found in slices on toast or in guacamole. Avocado oil is used in dressings, dips, and even baked goods. Smoothies, salads, and restaurant meals may contain avocado without clear labeling. For someone on blood thinners, these hidden sources add up quickly. A senior who thinks they are only having half an avocado a day may in reality be consuming much more. Over time, these unnoticed additions can raise vitamin K levels enough to interfere with the stability of their treatment. The risks extend beyond warfarin as well. Some studies suggest that avocado may influence how the liver metabolizes certain drugs, which can further complicate treatment. While the strongest evidence remains with vitamin K and warfarin, doctors still advise caution with any medication that affects clotting or circulation. This is especially important because seniors are often prescribed multiple medications, and interactions are not always obvious without careful monitoring. The safest approach for seniors on blood thinners is to avoid sudden changes in avocado intake. If avocado is already part of the diet, it should be eaten in small, steady amounts rather than in large, irregular servings. Doctors and dietitians often recommend keeping a food diary when on warfarin to ensure vitamin K intake remains consistent. If someone wishes to increase or decrease their avocado consumption, this decision should be discussed with their healthcare provider so that medication dosages can be adjusted accordingly. Avocado itself is not the enemy. The danger lies in the unpredictable way it interacts with medication. By paying attention to portion size and consistency, seniors can still enjoy avocado in moderation without compromising the effectiveness of their blood thinners. The key is awareness and communication with healthcare professionals. A healthy fruit becomes a hidden threat only when its impact on medication is ignored. Recognizing this connection helps ensure that the benefits of avocado do not come at the cost of life-saving treatment. Using avocado as a meal replacement is a mistake that can quietly lead to serious health problems for seniors. Avocado is often promoted as a superfood, and it is true that it contains valuable nutrients such as healthy fats, potassium, fiber, and antioxidants. However, it is not a complete food, and it cannot provide all the nutrients an older body needs on its own. Some seniors, wanting to simplify their diet or improve their health, may turn to avocado as the main or only part of a meal. This approach leaves the body without sufficient protein, essential vitamins, and minerals, which are critical for maintaining strength and resilience in later years. Protein is the most important missing element when avocado replaces a balanced meal. A medium avocado provides only about 3 grams of protein, which is far below the needs of older adults. Doctors emphasize that after age 50, muscle mass naturally declines in a process known as sarcopenia. Without enough protein in the diet, this loss accelerates, leading to weakness, frailty, and reduced independence. Meals built mainly around avocado, without adequate protein from sources like fish, beans, eggs, or lean meats, cannot slow this process. Seniors who rely too heavily on avocado may notice fatigue, slower recovery from illness, and increased risk of falls, all linked to insufficient protein intake.
Another concern is the lack of certain vitamins and minerals that avocado simply does not provide in high amounts. For example, avocado contains almost no vitamin B12, a nutrient essential for nerve health, red blood cell production, and brain function. Deficiency in B12 is already common among seniors due to decreased absorption with age. Replacing balanced meals with avocado makes the risk even greater, potentially leading to symptoms such as memory problems, tingling sensations, and anemia. Calcium is another nutrient missing in large quantities from avocado. Without adequate calcium and vitamin D, bone density weakens, raising the risk of fractures. A diet centered too heavily on avocado leaves these gaps unfilled. Relying on avocado also creates imbalances in calorie intake. While the fruit is high in healthy fats, these fats are energy-dense. A large serving of avocado provides hundreds of calories, yet does not offer the protein or complex carbohydrates needed to sustain energy and maintain stable blood sugar. Seniors who replace meals with avocado may initially feel satisfied, but later experience fatigue or lightheadedness because their meals are not truly balanced. Over time, this pattern can contribute to unintentional malnutrition, even while eating what seems like a healthy food. Nutrition specialists often point out that the term superfood can be misleading. No single food, no matter how nutrient-rich, is capable of meeting all the body's requirements. A complete diet requires variety, particularly in older age when nutrient absorption and metabolic efficiency decline. By focusing too narrowly on avocado, seniors miss the protective effects of other foods that supply vitamins C, D, and B12, along with iron, zinc, and high-quality protein. The body works best when these nutrients are present together, not when one food is eaten in isolation.
The safest way for seniors to enjoy avocado is as a complement to balanced meals, rather than as a replacement. Half an avocado paired with protein and vegetables provides far more benefit than a plate dominated only by avocado. In this role, avocado enhances nutrient absorption, adds healthy fats, and improves taste and satisfaction, all without displacing other essential foods. Using avocado as the main or only meal may feel convenient, but it comes with hidden risks that accumulate over time. Weakness, nutrient deficiencies, and reduced resilience are the silent consequences. Avocados should remain part of a healthy diet, not the foundation of one. By keeping it in its rightful place as a supportive food rather than a substitute, seniors can protect their strength, energy, and overall well-being. Eating overripe or spoiled avocados is a mistake that poses real risks for seniors, especially those with weaker immunity or sensitive digestion. An avocado that has gone past its safe point may look harmless, but inside it can harbor mold, harmful bacteria, or fats that have turned rancid. When these are consumed, the result can range from mild stomach upset to severe foodborne illness. For older adults, even a short episode of vomiting or diarrhea can quickly lead to dehydration, weakness, and complications that require medical attention. Recognizing when an avocado is no longer safe to eat is a crucial step in protecting health. The first danger comes from mold growth.
Avocados are particularly vulnerable to mold once they have softened beyond their peak. The dark, speckled patches that sometimes appear on the flesh are more than cosmetic changes. Mold produces toxins that can irritate the digestive system and, in some cases, trigger allergic reactions. Seniors with asthma or compromised respiratory health may be especially sensitive to mold spores, which can worsen breathing issues. Food safety experts consistently advise discarding any avocado that shows signs of visible mold, rather than trying to cut around it, because the contamination may spread deeper into the fruit than what is visible. Another concern is rancid fat. The healthy monounsaturated fats in avocado are one of its biggest benefits, but like all fats, they degrade when exposed to oxygen, heat, and time. Once the fats oxidize, they produce compounds that not only taste bitter, but also irritate the digestive system. Eating rancid avocado may cause nausea, stomach cramps, or diarrhea. Some studies suggest that long-term exposure to oxidized fats may increase oxidative stress in the body, contributing to inflammation. While a single spoiled avocado may not cause lasting damage, repeated exposure adds unnecessary risk, particularly for seniors already dealing with chronic health conditions. Bacterial contamination is another hidden danger. Overripe avocados with bruised or broken skin are more susceptible to bacteria such as Salmonella or Listeria, which can thrive in the soft flesh. For healthy younger adults, a mild infection might pass quickly, but seniors are far more vulnerable to complications. Listeria, for example, is particularly dangerous for older adults because it can spread beyond the gut to the bloodstream and nervous system, leading to serious illness. Even a small amount of contaminated fruit can be enough to cause infection in someone with a weakened immune system. Food poisoning from spoiled avocado can also lead to rapid dehydration. Seniors are at higher risk of dehydration than younger adults due to a reduced sense of thirst and the body's lower water reserves. When diarrhea or vomiting occurs, the loss of fluids and electrolytes can quickly become dangerous. Dehydration may cause dizziness, low blood pressure, confusion, or kidney strain, all of which make recovery harder. This is why even what seems like a minor episode of foodborne illness must be taken seriously in older age. The safest way to avoid these problems is to carefully assess avocados before eating them. A fresh avocado should feel slightly firm with a gentle give under pressure, and its flesh should be green and free from dark streaks or stringy fibers. Any sour smell, unusual taste, or slimy texture indicates that the fruit is no longer safe. Overripe avocados that have turned brown inside or developed an off-putting odor should be discarded immediately. Food safety specialists recommend erring on the side of caution because the risks of eating spoiled fruit far outweigh the small benefit of trying to save it. Seniors who want to keep avocados fresher for longer can store them properly by refrigerating ripe ones to slow down spoilage. Once cut, the fruit should be covered tightly to limit air exposure, but even then it should be consumed within a day or two. Refrigeration does not stop spoilage entirely, and relying on smell and texture remains the most reliable test. Trusting these signs prevents unnecessary exposure to harmful compounds. Eating avocado only when it is fresh ensures that its health benefits are enjoyed without risk. Overripe or spoiled avocados, on the other hand, carry dangers that can quickly outweigh their advantages, particularly for seniors with weaker immunity. By paying close attention to ripeness and discarding fruit that has gone bad, older adults can continue to enjoy avocados safely, protecting both their digestion and overall well-being. Ignoring allergies and digestive sensitivity when eating avocado is a mistake that can create serious health problems for seniors. Avocado contains proteins that, in some individuals, trigger oral allergy syndrome, which can cause itching, swelling, or irritation in the mouth and throat. Doctors note that this reaction is particularly common in people who are also allergic to birch pollen or latex. Seniors who already have a latex allergy may experience more severe reactions, including hives or difficulty breathing if avocado is eaten without caution. Even mild reactions should be taken seriously, because ignoring early warning signs can lead to more severe problems over time. Digestive sensitivity is another important consideration. Avocado is high in fiber and fats, which are normally beneficial, but seniors with irritable bowel syndrome, IBS, or gallbladder issues may find that even moderate portions trigger discomfort. Symptoms can include bloating, gas, diarrhea, or abdominal pain. Research shows that older adults are more likely to experience digestive upset from high-fat foods due to slower gastric emptying and reduced bile production. For someone with a sensitive digestive system, repeated episodes of discomfort can interfere with appetite, nutrient absorption, and overall quality of life. Some studies suggest that avocado can exacerbate reflux or heartburn in susceptible individuals. Seniors who already experience gastroesophageal reflux disease, GERD, may notice that eating avocado worsens symptoms. This is often due to the combination of fat content and natural compounds in avocado that relax the lower esophageal sphincter. Ignoring these early signals can lead to chronic irritation of the esophagus, making digestion even more difficult and increasing the risk of inflammation or injury. Awareness is especially critical for seniors taking multiple medications. Some drugs affect digestion or interact with certain foods, and adding avocado into the diet without considering sensitivities can amplify negative effects. For instance, bile acid inhibitors or certain cholesterol medications can change how fats are processed, potentially increasing the likelihood of diarrhea or abdominal cramping when avocado is eaten. Healthcare providers often advise older adults to monitor their response to new foods carefully and to report any adverse reactions promptly. Even small amounts of avocado can trigger symptoms in sensitive individuals. Research on oral allergy syndrome indicates that reactions can appear within minutes, meaning that early warning signs, such as tingling or swelling of the lips, tongue, or throat, should not be ignored. Prompt recognition and adjustment of portions can prevent escalation. Some dietitians recommend starting with very small servings and observing how the body responds before incorporating larger amounts. This cautious approach allows seniors to enjoy avocados safely while minimizing risk.
For those with known digestive or allergic sensitivities, it may be necessary to avoid avocado altogether or to consult a healthcare professional before regular consumption. Allergy testing can help identify risk, while guidance from a doctor or dietitian ensures that avocado is incorporated safely if possible. Ignoring these precautions can lead to repeated discomfort, nutrient malabsorption, and in rare cases, severe allergic reactions. Seniors can continue to benefit from avocado's healthy fats and nutrients by paying attention to their body's signals. Consuming small, measured portions, recognizing early warning signs, and seeking medical advice when reactions occur helps prevent complications. Being mindful of allergies and digestive sensitivity turns avocado into a safe, nutritious addition rather than a source of hidden health risks. Careful attention allows older adults to enjoy the fruit's benefits without sacrificing comfort or safety. Mixing avocado with too many processed foods is a mistake that can undermine its health benefits, particularly for seniors. While avocado is rich in heart-healthy, monounsaturated fats, fiber, and potassium, combining it with processed bread, salty chips, or mayonnaise-heavy spreads can negate much of its positive impact. Doctors frequently warn that processed foods are high in sodium, unhealthy fats, and refined carbohydrates, which can raise blood pressure, promote inflammation, and contribute to weight gain. For older adults, these effects are more pronounced because metabolism slows and the cardiovascular system becomes more sensitive to dietary stress. One common example is avocado toast on white or highly refined bread. While the avocado itself supports heart and brain health, the refined bread it is paired with often contains added sugar, white flour, and preservatives. These ingredients can spike blood sugar levels, promote insulin resistance, and reduce the overall nutritional quality of the meal. Seniors who consume this combination daily may find that the potential benefits of avocado are partially canceled out by the negative effects of refined carbohydrates, which can increase the risk of type 2 diabetes and cardiovascular complications over time. Salty snacks, such as chips or crackers, are another frequent pairing with avocado. Adding avocado to a plate of highly salted chips may create a satisfying snack, but it also dramatically increases sodium intake. Excess sodium is strongly associated with elevated blood pressure, a leading risk factor for heart attacks and strokes. Research shows that older adults are particularly sensitive to sodium because kidney function often declines with age, making it harder to regulate fluid balance. A single meal combining avocado with salty processed foods can push sodium intake beyond recommended levels, creating hidden stress on the cardiovascular system. Mayonnaise-based spreads and creamy dressings are also problematic. These items are typically high in saturated fats and added sugars, which counteract the healthy fats in avocado. Saturated fats can raise LDL cholesterol, the bad cholesterol, and contribute to arterial stiffness, reducing the protective effect of avocado's monounsaturated fats. Dietitians often emphasize that pairing healthy foods with high-fat, high-sugar condiments diminishes the overall benefit of the meal, particularly for seniors who are at higher risk of heart disease. Even small amounts of mayonnaise or creamy sauces can significantly alter the nutritional profile of a meal. Another concern is portion distortion. Avocado is calorie-dense, and when combined with processed foods that are also high in calories, seniors may consume far more energy than the body needs. Over time, this can lead to gradual weight gain, which increases the risk of hypertension, joint strain, and metabolic syndrome. Older adults often underestimate the caloric load of seemingly healthy meals because the presence of avocado masks the unhealthy components. Nutrition experts advise measuring portions and being mindful of the company that healthy foods keep on the plate. Even seemingly innocent combinations, such as avocado in sandwiches with processed deli meats or prepackaged spreads, carry hidden risks. Processed meats are high in sodium and preservatives like nitrates, which studies have linked to higher cardiovascular risk and inflammation. When paired with avocado, the nutrient-rich fruit does not neutralize these effects. Seniors who prioritize heart health must pay attention not only to what they eat, but also to what accompanies it, because a single harmful addition can diminish the benefits of an otherwise healthy food. The safest approach is to pair avocado with minimally processed foods, whole grains, fresh vegetables, lean proteins, or legumes. This ensures that the fruit's natural fats, fiber, and micronutrients are absorbed effectively and provide maximum health benefit. Avocado's role is to enhance a balanced, nutrient-dense meal rather than serve as a mask for processed ingredients. By avoiding unhealthy companions, seniors can enjoy the protective effects of avocado on heart health, blood sugar, and digestion without introducing unnecessary risks. Mixing avocado with processed foods may feel convenient or tasty, but it can quietly undermine well-being. Seniors who are mindful of pairings, choose whole ingredients, and limit sodium and saturated fat can make each serving of avocado a true contributor to long-term health. Healthy food should shine on its own, not be drowned by unhealthy companions, and careful choices allow older adults to enjoy both taste and nutrition safely. Remember, avocado is a powerful ally for health when enjoyed the right way. By avoiding these 6 common mistakes, eating too much at once, ignoring its effect on blood thinners, using it as a meal replacement, eating overripe or spoiled fruit, overlooking allergies or digestive sensitivity, and pairing it with processed foods, seniors can protect their heart, digestion, and overall well-being.
Small changes in how it is consumed make a big difference. If these tips helped, take a moment to like this video and share it with friends or family who also want to stay strong and healthy. Don't forget to subscribe and hit the notification bell so you never miss practical advice that can make a real difference in daily life. Staying informed and cautious is the best way to enjoy avocado safely and fully benefit from its goodness.